23, and let's go ahead and just get the show started here with the administrator from the Guam Memorial Hospital, Lillian Posadas, of course, joining us by way of the Zoom. Good morning, Lillian.
Good morning.
Good morning. Good morning. How are you all?
We're doing pretty good.
How about you?
I'm doing great. Doing great. Thank you.
Well, first of all,
busy, but we're just staying the course.
Thank you for coming
doing
into
what
work
we need to do
early to Zoom with us. Yeah.
Thank you for the invitation.
Yeah, Lillian, I guess let's just start. We'll give you the floor. If you could just give us a status update on COVID-19 and the Guam Memorial Hospital, the response, who was hospitalized, what are we looking at in terms of that?
All righty. First of all, I just want to make sure that we clarify the information that's circulating out there that
Right.
It's not accurate, not correct, and definitely not credible. And so I just wanted to take this opportunity to make sure that,
Yeah, you're right, Lillian. Let's actually start there. There was a release that came out from the Joint Information Center yesterday, right?
Right.
I think Bree's popping that up right now. This was Joint Information Center release number 241, if you're keeping track at home.
Yeah, they're just asking everybody to be aware of unverified messages circulating on chat groups and social media about positive COVID-19 cases at GMH. And then it states that there are currently 5 individuals in the ICU at GMH. The JIC is also aware.
That's
right. I'm sorry. Not
Okay,
in the ICU, but in the
yesterday
COVID care unit at GMH.
Okay. Yesterday there were 5. One got released, and so we still have 4.
Okay.
And of the 4, 2 of them are deemed as needing ICU level of service, level of care. They just need to be monitored more closely and supervised more closely because of their respiratory symptoms. The other 2 individuals were initially telemetry level of care, but now they have been downgraded to just regular medical care, meaning that their condition have really stabilized and they don't need that close cardiac monitoring service.
Lillian,
and so that is the...
If you could, can you explain the differences between like telemetry and the downgrading to a less intense status, just for the people out there who aren't doctors?
Sure. Telemetry meaning they need to be monitored, their heart rhythm, their heart rate, how their cardiac condition is, progressing or how it's acting, whether it's in a normal heart rhythm status or there may be some aberrancies or premature beats or the heart rate is beating very fast. And so they're monitored through an electrocardiogram, a continuous monitoring capability. They have wires on their chest that are placed externally, and so their heart rhythm, the electrical heart rhythm, is monitored on a screen to make sure that the rate, the rhythm are all within normal, parameters. So that's what telemetry is, and downgrading them to medical, meaning they're no longer needing to be monitored. Their heart rhythm does not need to be monitored through the cardiac monitor system. So they've stabilized that they don't need to be monitored with their rate and their heart rhythm continuously. So, and they're ambulating, they're stable, and so that's what that downgrade means from a telemetry to medical.
But that doesn't mean that they're in ICU, right? If they're in telemetry?
They're not in ICU,
okay,
no.
okay.
They're not in ICU. They are in another COVID care unit, which is our Care 3.
Okay.
And so that's up on 4th floor. So, that's a care unit that does not require individuals to be on a telemetry monitoring system.
Lillian, was there ever any point where they were in the intensive care unit or any of the COVID patients that you're currently caring for?
To maximize our resources, we placed all 4 of them initially in what we call Care 2 unit, which is what we ramped up as an ICU COVID care unit, because we ramped it up with the capacity to be able to, if the patient's condition deteriorates, we can put them on a ventilator, and so it's a small confined unit that the nurses can visually observe and monitor those patients' condition should all of a sudden it changes. And so that's what that Care 2 unit is. It's an ICU level of COVID care.
Right.
But,
So I'm sorry, Lillian, just to clarify, is it really, because we're talking about these unverified messages, and, I got the message, and it basically said that there were 4 patients in the intensive care unit. But you're saying that they weren't in the intensive care unit per se, they were in the COVID Care 2 intensive care unit.
I see.
So it's kind of confusing.
Yeah,
right, yeah.
It's an ICU level care unit for COVID patients specifically.
Right. So that's
just they ramped it up.
Right. So I'm just wondering if you're telling us not to share unverified messages, but you're saying that they were in an ICU type setting. Is it really an unverified message? I mean, if you could, because it just seems like an obvious question.
Well, but again, it's confusing because it's not just a straightforward. Yeah, they are in that COVID ICU unit. Because of our resources, we want to maximize the resources and contain them in that one area that has the flexibility to be an ICU or just, it's a COVID unit.
Right.
How many COVID care units are there? And could you just share what each of them are specifically set up for? Because you said there was a COVID 3, COVID. Now we know there's COVID 2.
Is there a COVID 1?
There is a COVID 1, and that was the original COVID unit that when we started in March receiving POI patients who then we test them. Because remember, in the beginning, we weren't doing these rapid testing. We had to keep them in an area, isolate them, and then, once we get the results from public health and that they're negative, we move them out of there. But that's the care unit 1, right next to ER. It has a capacity of 5 beds. Right next to it is a COVID Care 2, and that's between ER, Care 1, and ICU. It's another 5-bed unit that we ramped up to be ICU, to be able to provide ICU level of care. Care 3 is up on 4th floor. It's the old pediatrics unit. We moved all our pediatric patients out of that unit and converted it to a isolation COVID Care 3 unit. It has 17 beds.
How many people are in COVID 3?
In COVID 3,
yeah,
because we downgraded those 2 individuals to medical, we moved them to COVID 3, which is the 3rd floor, so 2 of them are there.
Okay, so only a total of 2 are in COVID 3.
Only a total of 2 are in COVID 3, and a total of 2 in COVID 2. And those are the 2. Go ahead.
Oh, I was going to say, what about in COVID 1?
That one, we haven't been using it specifically to just keep COVID patients. We use it for PUI, and we also use it as an overflow for the emergency room. Because many times we've had patients waiting, and it's an overflow.
I see. So do you have any PUIs in COVID 1?
Not in COVID 1 right now, because we still have some space in the emergency room. We have isolation, and there is an individual in there who is a PUI.
Okay, so that's where we get the total of 4.
The total of 4 are the ones, the 2 in the Care 2,
right,
and the 2 in Care 3. They're all COVID positive. So those are the 4.
Okay, and initially there was 5, and then the 1 was
yesterday
released.
There were 5. One got discharged. Correct. Yes.
To home isolation?
Yes, ma'am.
Yeah.
Home isolation.
Lillian, without going into specifics, what else can you tell us about, maybe the condition? I know you said stable, but in terms of what is affecting these patients?
Okay, well, the 2 that are in the ICU Care 2, COVID Care 2, because of their respiratory symptoms, they still need supplemental oxygen through nasal cannula. They're not intubated. They're not on ventilator or, support, mechanical support at all. Unlike what was, put out there in the media that they are on support, life support.
So you said nasal. What was that? Sorry.
Nasal cannula. You
So
know, a
that
two-prong nasal cannula
the two hoses
of
that go in the
oxygen.
nose. I see.
The hoses that go into the nose, your nasal cavity, and you get supplemental oxygen that way.
Okay. So it's respiratory issues related to COVID-19.
Yes.
Right. Are you able to give us any of the ages of these patients?
Sure. I mean, I don't want to be specific to their
Right.
ages because that identification can be a HIPAA violation.
So,
but the age range is from 30 to early 50s.
okay. And are you able to tell us if these cases are related to each other in terms of the COVID spread?
Well, they are connected to each other, as what was put out in the JIC. So they are connected to each other, yes.
Okay. So PCOR 3, we're in PCOR 3. We get news like this about these hospitalizations. Obviously, it's blipping on a lot of people's radar. And throughout containing COVID, you were a really sobering voice. So kind of interested to hear what message you have for the people of Guam when they wake up and find out that, you know, our hospitalizations.
You know what, Chris, it was kind of breaking off. Can you say that again?
Just so, how serious should people take this now that we're hearing this news about these hospitalizations?
It's very serious, and it's, you know, it's a concern that everybody needs to own up to it and be responsible. But the other thing is, you know, we need to not be giving out false information, inaccurate, you know, not credible information, not factual information, because it creates more anxiety and panic. What we need to do is just to be concerned about it and be responsible, to then make sure that, you know, we continue to wear masks and we continue the social distancing, because we see already that it works, the mask. And, you know, there's a lot of people out there, if they don't need to be out there and stay home, then, you know, please stay home. Take this very seriously and be concerned about it, but don't panic. Don't be fearful. Don't panic. Just be concerned, be very concerned, and be responsible to, you know, to do your part, to stay home, to wear your mask if you need to go out there wherever you go, because this virus does not discriminate. Age does not discriminate. Ethnicity. It's a virus that jumps from one human to another, especially if the individual is not protecting himself or herself with the proper infection control precautions. And so anybody can get it. And
are these
not
local?
knowing that you have the symptoms or that you have the infection, the virus, you spread it. So yeah, again, go ahead.
No, I just wanted to follow up on one of the things you mentioned with the COVID-3 in the old pediatrics ward or unit. I know months ago we were talking about moving the labor ward over to GRMC and, you know, moving the pregnant moms over there. Whatever happened to that?
It didn't happen. Okay. You know, it was too complicated, too many logistics. GRMC, as much as they're trying to help us out, they're also challenged with staffing. And, you know, they don't have their MCH staffing anymore. So if we were to move, you know, the patients, MCH patients over there, that means we have to also send our staff nurses there, our nursing staff. And, you know, the logistic with that in terms of liability, payroll, you know, the government benefits, because we're government employees into the private sector. It was just too complex, too complicated. Yeah. So Lillian, when the census goes down in the pediatrics and in the MCH, we utilize their you know, the staff to then help out in the other areas where, you know, the census has picked up. So it gives us that ability that if the census is not that high, we can then move around the staffing to help in the areas that are needed.
So Lillian, I remember when we were discussing this move, part of it was that, you know, GMH was supposed to be, God, I hate saying this, the COVID hospital. Yeah. Right? And we were going to move everyone out of there. So since we didn't move them, were there any additional measures or anything put in place to kind of mitigate the things we were trying to protect these pregnant women and children from?
Women and children and the non-COVID patients.
Right.
Unfortunately, we still, both hospitals, GRMC and GMH, you know, we're challenged with with staffing, but more so over at GRMC. You know, their staff bed capacity is less than 100. Ours, we can accommodate over 100. In fact, our census picks up to about 140, 150 at times. And so, you know, we continue to accept as much as we wanted to decompress our non-COVID areas. We're challenged in doing that.
Right.
And so we just deal with it on a day-to-day basis. And so what was the other part of your question, Chris? I'm sorry.
I don't know. A brain fart. Sorry, I forgot. No, I was just saying, since we didn't move them, did you do anything extra to protect them from, you know, what we were trying to move them for?
Well, we have put in measures to protect the MCH population. You know, we keep them isolated, and we certainly don't use the staff. If the census is low, we don't use the staff into the COVID area. We use them in the non-COVID area when they're needed. And so we try and protect also the staff, the MCH staff. What was that?
No, that was just Jason talking in the background.
Yeah. So Lillian, now that we're kind of pivoting a little, and again, I'm taking it serious, but we're in PCOR 3. So what types of adjustments have you guys made at the hospital to put us in this new footing?
Okay, adjustments. We're adjusting every day. We're adjusting our protocol. We're adjusting our PPE, supplies. We're putting into place. We're working with the company to sterilize our N95 masks, and so that we can conserve our PPEs and reuse them if we can reuse them, but we have to sterilize them. We're the doctors in their meetings, they continue to adjust the protocol to be in line with the CDC regulations. Visitation privileges, we've made it more strict in terms of really limiting and not allowing individuals under 18 to come into the hospital, just again for the safety of those individuals under 18. We're limiting again because, we were finding out that some patients would have a listing of 25 people to come and visit. And so wow. we don't want to increase the traffic in the hospital with visitors who don't need to be here, because we're moving patients around, we transfer patients around who are COVID. And so, we want to make sure that there are no people around when we're transferring these, moving these COVID patients around from one area to another, to radiology, to, other areas of service. Mm-hmm. Does that answer your question?
Yes, it does, Lillian. Can we, did you have any more COVID stuff?
Yeah, I just wanted to ask about what other sort of preparations you guys are doing over at the Guam Memorial Hospital, and are possible changes or contracts that you guys might need, or even hiring of additional personnel. We haven't heard any new projections or anything like that. The last time I think we heard from Dr. Cabrera in one of his presentations at Adelup was that possibility of a September surge. So I'm just wondering, are you guys doing anything to prepare for the potential of that?
Well, every day we're concerned that there may be, just like, this over the weekend, we had 5 individuals. Right. And for a while we were at 0 or 1. And so, yeah, we're very concerned. And so we're just trying to make sure that, all staff are on board when we need them. And we continue to recruit staff, especially nurses and in the allied health, respiratory therapists. Nurses, we lose nurses. They leave, they resign, they retire, and so it's a revolving door to recruit nursing staff, especially registered nurses and licensed nurses. And so, every day we take a look at the census and, okay, what do we need to do to make sure that we are prepared? We have the SNU patients and residents away from our facility, and so we want to continue to keep them away from the facility to protect that vulnerable population.
Mm-hmm. Okay. Any equipment that you've had to purchase?
What was that?
Equipment. Have you guys purchased any new equipment that you might need?
We've purchased, the PAPRs. Those are the pressurized the powered air pressurized respiratory mask. We've purchased those. We've purchased more high flow nasal cannula oxygen devices. We've purchased demystifiers. We continue to look at our equipment to make sure that we have what we need to then be able to provide the treatment for these individuals who come in with the COVID infection.
What about the ventilators? Because I know FEMA had brought in a bunch of ventilators.
Oh, yes. Yes, initially we received about 25 ventilators, the fusion care ventilators, and then we received another shipment of, no, first it was 35, then the second shipment was 34, so we've got 59 care fusion ventilators that are available, and we keep it available, and they've been certified by our biomed experts, and so it's ready. The ventilators are ready.
All right. Thanks, Lillian.
Yeah, Lillian, if we could, we wanted to ask you about fentanyl. Have you heard anything at all about any patients being seen, any deaths related to, or just anything at all about fentanyl or fentanyl-laced prescription pills that may be going around?
I've heard some cases of individuals, and I know that there is an investigation going on for some data on the fentanyl use, fentanyl abuse. On occasion, we do have individuals that come in with, drug-related medical condition, but I'm not quite sure exactly what type of, drug use or drug abuse that we get those patients.
What can you tell us about the dangers of fentanyl that you've been able to learn about it?
Well, narcotics, they have their therapeutic use, but if it is abused or used in high dosages, respiratory, cardiac, neurological symptoms or conditions that can get altered by these narcotics in general. And so, again, it just, people just need to really, if they're getting the prescribed narcotic for pain management or for, cancer condition, then, then they just need to stay within that prescription from the doctor, but they also need to make sure that their medication doesn't get used by other people in the household.
Right. You said an investigation that was going on. Is that an investigation being conducted by GMH or?
No, not us. We're not doing that investigation. We manage the medical treatment of those individuals. But I'm just hearing that there's some ongoing investigation. Who's taking the lead? I don't have that information.
Okay, so you said who's taking lead. So is it a joint investigation then, from your understanding, with the feds and the local law enforcement?
Probably. I'm sure they are. They're the ones with that authority, with that jurisdiction to conduct those investigations and to look into, what's going on in Guam with regards to that, because that's happening nationwide. And I guess maybe they're just getting information.
Are you confirming that it's a joint investigation to the best of your knowledge between federal and local?
There is an investigation being there is data being looked at, but I don't know who all other than the authorities who have that jurisdiction, that the responsibility to look into that. Lillian, and how it's affecting our island.
Right. Do we have the capability to determine if someone died from a fentanyl-related overdose?
If it's suspected, I'm sure they would do a toxicology screen to see what medication or what drugs are in the system. What the toxicology screen is what would identify.
And so fentanyl is something that would show up on that?
I'm not an expert in that, but probably the metabolites of those types of drugs that are, illicit drugs or, narcotics that can be prescribed, but then, if there's an overdose of it, or excess amount of metabolites of that particular, drug.
Have any staff or employees at GMH been questioned in relation to this investigation that you mentioned?
I haven't heard any of our staff who have been interviewed or questioned about it, investigated. I haven't heard that one. Okay. And it should come through our administration office.
Mm-hmm. Other than you just heard that there was some sort of an investigation.
Yeah.
Oh,
so do you have any knowledge of any fentanyl-related deaths on Guam?
I don't. I don't have that data. I don't have that knowledge.
What would the protocol be? Let's say if someone did overdose on anything with fentanyl or just anything, any drugs in general, and they die, what happens with the body? What happens with how you guys look into that cause of death, and when would the medical examiner become involved in a case like that?
If the authorities, like the police authorities, suspect that there's a, possible homicide, then I guess they would have to have a forensic autopsy done on that body, expired body.
Which we're having a problem doing because we don't have the medical examiner, right?
Well, there is a contract for pathologists, forensic pathologists who are based in Hawaii. So there is a contract right now that if the authorities, the police authorities, the Attorney General's office think that this needs to be, the body needs to be, autopsied for forensic investigation, then the pathologists in Honolulu are, contacted, and the coordination for them to come to Guam and do the forensic autopsy.
So do you have any knowledge of any forensic autopsies that have been conducted because of any drug overdoses?
I don't oversee CME, so I don't know which ones are done as far as forensic autopsies.
Okay, but you didn't hear anything.
CME is not my.
I know.
CME
but
is not my.
Well, you guys are in the same building, so I'm just checking.
Okay.
I don't know if you heard anything through the vent or.
I get calls every now and then about CME, but again, I don't oversee that that agency, so I don't really know.
All right. Well, thank you so much. Did you have anything else?
Yeah. In closing, Lillian, what would your message be to people out there listening to the hospital administrator, Lillian Posadas, right here on the link, Breeze 93.9 KUAM FM? I got you.
Well, again, I ask the community to please, whatever information you hear or you receive, make sure it's credible, it's accurate, and, like those people who are in authority to provide that information, that's what you take that information from. But those who do not even work at the hospital or have any authority to release any information, please make sure that you at least get your information that is credible. And everybody, please continue to be vigilant and continue to wear your mask, continue to do social distancing and hand washing.
Right, wash your hands. Okay,
wash
Lillian.
Your hands.
Thank you, Lillian.
Take care.
Okay.
Thank you.
That's
Bye.
There you go. Hospital Administrator Lillian Posadas there with a pretty interesting interview. 7:02 on the link. Bree, any post-Posadas thoughts?
No, there's 4 people that she mentioned that are hospitalized over at the Guam Memorial Hospital. 2 are in the COVID-2 care unit where they provide ICU level care. And then there are 2 that are in their COVID-3 unit, and that's more of their isolation unit.
Right, but you can see that when they put out these don't share unverified messages, I'm just playing devil's advocate here. You know how Guam is, and people hear things, they put it out. But I'm not really sure if I see a big difference between the so-called unverified messages that were going around in terms of the numbers of people who were at GMH.
Right. Well, the message that was going around, I believe it said 5.
Right.
5. And Lillian clarified that yes, there was initially 5.
Right.
And 1 was released to home isolation, and then the remaining 4 that are still hospitalized at GMH.
But the message also said that they were in the intensive care unit, which she said wasn't necessarily true because they're in the COVID care intensive care unit. So you see what I mean? It's kind
of course I do.
Yeah. So there you go. 7:03. We're going to take a break and we'll come back. We got Mary Rhodes from the Guam Hotel and Restaurant Association, and then we're going to talk quarantine and COVID, two of Sabrina's favorite subjects.